Hello, my name is Chris Ward, and I'm inviting you to think for a few minutes about what it means to feel ill. My qualifications for talking about illness are firstly that I've been ill myself, nothing serious, but I have. In other words, I'm a human being. Secondly, I've been something that people say is very different from a human being, a doctor. As such, I've worked with lots of people with acute illness, and I've also been in close contact with many people over many years with chronic neurological conditions. Thirdly, at various times in my own life, members of my family have had quite serious health problems. And my fourth qualification on top of all that is that I've been giving illness and wellness a lot of thought, much of it captured in my book, Between Sickness and Health, The Landscape of Illness and Wellness, published in 2020. In my book, I start with the problem of illness and end with thoughts about the abilities we have or that we can develop to contend with all kinds of illness, from the trivial to the terminal. When you're recovering from illness, there often comes a moment when you say to yourself, "Oh, I'm me again. I'm well." There's something rather puzzling about this, because it's hard to put your finger on what's different about you now. Why do you feel this way, and what was it you felt yesterday? Think about those times when you've had a cold or an episode of food poisoning or a bout of flu. From a doctor's perspective, these are different things, but they all produce feelings of illness. And the same feelings, or very similar ones, are produced in other very different situations. For example, a crushing migraine attack, if you've ever had one of those, or an episode of chronic fatigue syndrome, also called ME, or severe depression. What can you say about your own experiences of feeling ill? It's really no use at all turning to medical textbooks for answers to that. Here is my Bible from when I was a training physician, Harrison's Principles of Internal Medicine. Let's look up illness. What do we find? Here we are in the index. Well, we've got iliac abscess on page 760, and we've got Imerslund's syndrome on page 1591, whatever that is, and between the two, nothing about illness. Turning to disease, there's lots and lots. Approach to disease, computer in disease, history taking in disease, genetics of disease, and so on. The point really is that textbooks are about diseases, and illness is not the same thing as a disease. A disease doesn't always make you ill. Athlete's foot is a disease. Dental caries is a disease. Most of us have some of that, but by and large, those things don't make us feel ill. I'm afraid you can be infected with coronavirus and even have extensive cancer and feel fine. A human body that is diseased but not ill is in exactly the same position as the horse chestnut tree at the bottom of my garden. It's diseased, so that even now in high summer it has blotchy spots on its leaves. But I'm fairly sure it doesn't feel ill. So you can also feel very ill without having a disease. It's quite doubtful whether ME is a disease in the sense that coronavirus infection is. And few people nowadays would want to call depression a disease. I certainly wouldn't. And yet these are two states in which a person may feel very ill. There's something about being a human being that makes it possible to feel ill without having a disease. I think we should assume that all animals can suffer. Probably snails can. We know very well that horses and cats and dogs can suffer, but it's injuries and diseases that make them suffer. You don't hear a vet diagnosing illness in your horse or your dog without suggesting that there's a disease causing it. Animals don't, I think, suffer without having a disease, which means that you don't really need two different words in the animal kingdom, because illness there means the same as disease. That's not the case with humans, which is why I think we need to recognize feeling ill as a specifically human experience. I think that we really need to reserve the word illness mainly for people. In my book, I argue that the essential element of our illness experience as humans is the feeling that I am not myself, and that's something that a snail probably can't experience, and I'm not sure even that a dog can. When I'm ill, I'm not myself, and when I'm well, I'm me again. And this is true of illnesses, whether there is an underlying disease or not. And that's why we need two words, I think, illness and disease. When I was a medical student, the primary object of study was disease, not illness. We did use the word illness, but for us it was about the severity of a disease rather than the experiences of a patient. There were two kinds of patients in our minds: those who were genuinely ill and those who weren't, which shaded into the idea that some patients had fake illnesses. Symptoms that mimic disease are often produced by emotional states. It's very easy to get worried about the transient pins and needles and itches of normal life and then to wonder if you have MS. I've occasionally wondered if I had motor neuron disease. When we detected symptoms that imitated a real disease, as we called it as training doctors, we often put those symptoms down to anxiety and told the patient that there was nothing wrong. Many people were immensely relieved to hear this, but it's hard to accept that you aren't ill when you're convinced that you are. One morning, the ward was very quiet for once. Not maybe as quiet or as well staffed as this one from 100 years ago, but you get the idea. A GP phoned asking us to admit a young woman. I'll call her Bella. She had a very worrying history, and the diagnosis that occurred to us for some reason was tuberculous meningitis, a potentially devastating condition that makes a terrible mess of the base of the brain and gives you troubles with vision, hearing, mobility. While we were waiting for the ambulance to bring her in, our thoughts were dominated by the idea of this woman with tuberculous meningitis. The woman with tuberculous meningitis also became a character for us in our imaginations, a person with a threatening illness, someone who needed us. It took less than 12 hours for us to see that in our terms, Bella wasn't ill at all. I'm not suggesting she was pretending, because I don't think any of us thought that she was, but her history was full of inconsistencies. She had no definite abnormal physical signs, and plenty of positive evidence that these rather dramatic symptoms were functional. In other words, they weren't due to a disease. We diagnosed hysteria, which would now be called conversion disorder. Bella had been the centre of a medical drama when we thought she had a life-threatening disease, but now she was just that girl with hysteria. I was very struck by Bella's dramatic fall from grace as she was wheeled to the very end of the ward, where patients with the lowest levels of need languished. And believe you me, every ward, however busy, has a languishing area where there's a collection of patients that nobody really wants. Nobody thinks they're ill, they shouldn't be there, they need to be sent no matter where, but get them off this ward. We didn't stop to consider what Bella needed. We only knew that she didn't need us. I wonder how the dramatic transition affected her. What was it like to be first honoured and then ignored, at one moment cared for, the next neglected? From my family therapy experience, I'd hazard a guess that the same kind of thing had happened to her before. It was probably a pattern. Many people who present to hospitals and doctors with strange symptoms have had experiences of being rejected or abused. I don't think we should have thought of Bella as a fake, and we definitely shouldn't have made her feel like one. There was a sense in which Bella was indeed feeling ill, even though she had no disease. Or another thought is that if we think of illness as not feeling myself. Maybe Bella didn't quite know what her self was. But however you looked at it, Bella's experience needed its own attention, irrespective of whether she had a disease or not. The same confusion between illness and disease also operates the other way around. As I've said, we shouldn't assume that someone who is ill must have a disease, but nor should we fall into the trap of thinking that someone with a disease must be feeling ill. Sadly, there are still people who imagine that someone with a visible disability must be ill, and of course that's utter nonsense. During my specialist training, I met hundreds of people with Parkinson's disease. They often looked ill because they had blank faces, stooped postures, distressing looking tremors and involuntary movements. But if you asked them if they felt ill, they generally told me they didn't, which was an important lesson for me. A doctor might be able to tell you that you've got a disease, but a doctor can't tell you whether you're in pain or not. Only you know. The same thing is true of illness. Only you know whether you're ill. One reason for this is that only you know if you're feeling yourself or not. I'd love to hear from you if you're interested in any of these ideas. Here's my blog where you'll find details of my books.